This is Team 8 reporting on cinnamon. We have John Check, Eleanor Thaler, Lee Pham, Andre Leem, Cassandra Saunders, Ababa Dabiba, Ifan Lee, and Michael Tobin.
Cinnamon has many different names. Some of these names include Ceylon cinnamon, Sri Lanka cinnamon, Batavia cassia, Laura cinnamomum, and Cinnamomum verum. In China, different types of cinnamon are distinguished, but here in the United States, all of the types are referred to commonly as cinnamon.
Cinnamon can be used both orally and topically. Orally, cinnamon is indicated for the treatment of diarrhea, nausea and vomiting, the common cold and flu, flatulence, type 2 diabetes, for use as an antioxidant, and for use as an appetite enhancer. Topically, cinnamon may be indicated for use as a mosquito repellent and for the treatment of premature ejaculation.
Apart from commonly known uses as supplement, cinnamon is also an important raw medication in traditional Chinese medicine. Cinnamon was first documented in Shen-Nong Ben Cao Jing between approximately 200 and 250 AD. It is widely used in many traditional Chinese medicine prescriptions.
A potential benefits of cinnamon includes its effects on lowering blood glucose. Cinnamon contains procyanidin, oligomers, which is a precursor to cyanidin, which is responsible for anti-diabetic properties. Cinnamon also reduces lipids in non-alcoholic liver disease patients by inhibiting alpha amylase and alpha glucosidase. It also decreases LDL cholesterol and decreases insulin concentrations.
Cinnamon also contains anti-inflammatory compounds, which help to reduce the prostaglandin production. It also treats the premature ejaculation. So the commercial product right now is SS cream, which help to prolong latency and reduce penile hyperexcitability. It also has some insufficient evident benefits such as mosquito repellent, allergic rhinitis, candidiasis, salmonellosis, and irritable bowel syndrome.
Considering cinnamon's potential risks, it appears to be well tolerated. Significant side effects have not been reported in most patients, and rare cases of cinnamon may cause rash or allergic skin reactions when used orally or topically.
There is a risk of hepatotoxicity when it is consumed in large doses of 50 to 7,000 milligrams per day due to the coumarin content. Risk of hepatotoxicity is minimal when used in normal dosing. It should be avoided in patients with existing liver disease, and increased monitoring is warranted in patients taking other hepatotoxic drugs such as statins, methotrexate, and leflunomide. One incident has been reported of cinnamon linking serious side effects to a child.
Cinnamon can interact with medications and supplements. First, cinnamon can lower blood glucose levels, so it has additive effects for anti-diabetic agents, such as glimepiride, insulin, metformin. Second, cinnamon powder may absorb tetracycline's antibiotics, so it can reduce the effectiveness of tetracycline's antibiotics, such as tetracycline, dimethylcycline, and minocycline.
Cinnamon can also interact with azathioprine, as they both can increase the likeliness of hepatotoxicity. Other herbs and supplements that may reduce blood glucose levels, such as garlic, guar gum, and horse chestnut, as well as panax ginseng, should be monitored when taken together because they have an additive effect on decreasing blood glucose levels. Some recommendations when taking cinnamon include patients with existing liver disease should not take cinnamon as it can exacerbate the condition. And if patients are also taking other hepatotoxic drugs, it should be monitored to ensure that there's no further liver damage. And also, patients using anti-diabetic agents or herbs and supplements that may lower blood glucose levels should talk to their doctor to make sure that they have the correct dose to receive the correct blood glucose level. And then if patients are using a tetracycline antibiotic, they should speak to their doctor to ensure that the antibiotic is working properly and that they're getting the full dose. And then lastly, again, patients using azathioprine should monitor hepatotoxicity.
Thank you for watching. This presentation was created for you by
The Creator.